Hello and welcome to the Diabetes Army Rebuild podcast. My name is Dan, type 2 diabetic, actually pre-diabetic at this point. And this is my weekly podcast, finding the latest studies, peer-reviewed studies, and trying to make your world a lot better as a type 2 or pre-diabetic as you move forward in life, trying to make us all healthier, happier, and just add years so that this disease doesn't just rob us of what we've got. So this week is going to be an interesting week because we're going to talk about the much controversial low carb or keto diet, if you will, and type 2 diabetes. There's so much swirling around this, and we will talk about my experiences after. However, I wanted to really find some studies that have been done on this and put this all in perspective as far as things go. So here we go. So I found, here's an abstract, and this has been based on a number of studies with low carb or keto. And so let's talk about a low carb ketogenic diet, the LCKD, originally was a treatment for childhood epilepsy and is currently gaining acceptance as a nutritional therapy for obesity and type 2 diabetes. In addition, this diet has a positive effect on body weight, blood glucose level, hemoglobin, plasma, lipid profile, and neurological disorders. Okay, so these are studies that they've done and that are actually proving out. So it has shown that, I've got a couple different ones here, but it's shown that the keto diet or low carb diet contributes to the reduction in the intake of insulin and oral anti-diabetic drugs in patients with type 2 diabetes. Furthermore, the data presented in this review reveal the efficiency and cost effectiveness of the low carb or keto diet. So just by changing your eating habits, your nutrition, what it's telling us is you can literally change your health. And in all fairness, that's what I did. I had gained so much weight. I'm a former pro wrestler. I spent 12 years on a wrestling tour, and I had gone up to well over 400 pounds. And when I went to turn this thing around, this was the first thing I went to, and we'll talk about that in a minute. So here's a study, excuse me. And in this study, let's see, it's a number of people on it. I'll name a couple: Joshua Goldenberg, Andrew Day, Grant Brinkworth. There's a number of people that are on this study. So let's talk about what they found. The objective to determine the efficiency and safety of low carb diets, very low carbohydrate diets. So they did two studies, one with low carb and one with very low carb for people with type 2 diabetes. So with that said, let's get to the results. So the study selection randomized clinic trials evaluating low carb, and now this means on the first one with low carb, it would make up 26% of the calories in a 2,000 per day calorie diet, okay? Now, on the very low carb, that would make up 10% of carbohydrates. And it was studied over 12 weeks for adults with type 2 diabetes. So you had to have type 2 diabetes. You're going to do two types, one with low carb and one with very low carb. And the very low carb would represent 10% of your total daily calories in carbohydrates, all right? So primary outcomes were remission, once again, remission of diabetes. And now they're defining diabetes as 6.5, right, your A1C level or above, right? So it's saying that people went into remission. Now there's some interesting statistics that are coming out of this. Check people at 6 months and they check people at 12 months with the diabetes, and they got the test results back, and here's what they found, right? All articles and outcomes were independently screened, extracted, and assessed for risk, bias, and grade. Certainty of evidence at 6 and 12 months follow-up, okay? So during this, they had 14,759 citations in the study, yielding 23 trials with 1,357 participants. So you can see it was a pretty good, skew of people. At 6 months compared with the 12 months, it was really interesting what they came upon. So basically the study, at 6 months compared to 12 months, the people on the low-carb keto diet, their A1C dropped, let's see here, I think 0.17 is it? And those with the, hang on, here we go. At 12 months, the clinical important improvements were seen in weight loss, triglycerides, and insulin sensitivity. So at 6 months, at 12 months, much less. So in other words, when people did this, in the first 6 months, they had way more effectiveness than when they did it for 12 months. And what they're chalking that up to is by the time people finished the 6 months, heading into the 12 months, they became less strict on their diet. So they found great results in the first 6 months. It reminds us of another study that we did, I think it was last week on the podcast here, where we talked about people who, if they dropped down 10% of their body weight, had a much better chance of putting their type 2 diabetes from the get-go into remission in the first year. But if you dropped your body weight by 10% in the first 6 months, you had twice as good a chance of putting it in remission as the other people. So to be clear, let's recap that briefly. So the first 6 months, great results. When they measured at 12 months, not as good. But again, they're chalking that up to the fact of how strict people were continuing on the diets, right? Yeah, the effects were explained by diet adherence. So, people got less strict. The very low carb diet is just a lot harder to do, especially because especially when you come from the other side of just eating whatever you want, and now you're going to be on a really restrictive diet. That's tough to do. People can generally do it for 6 months, but at 12 months it kind of goes south. So the evidence is clear. For a low carb diet for 6 months, may experience remission of diabetes without adverse consequences, and that's big, right? They study everything around this as well. So it says, as well as the efficiency, safety, and dietary satisfaction with this diet. So when I started my reboot to fix my health, what I did was I went in and I was well over 400 pounds. I was eating whatever I wanted to eat, and I went to 50 net carbs a day. I don't even know how many carbs I was on before, but I went to 50 a day. And from there, I went down to 30 net, and then I went down to 20 net as I continued along the path, and then finally I went to 20 total. Once I got down to the 20 net, I found it pretty easy to flip over to 20 total carbs a day. On this diet, of doing this, I lost 80 pounds in 8 months. So I was going at about a 10 pound a month clip. That's a pretty heavy clip. Please remember, I was 400 and some pounds. So if you're, 200 pounds, you might not be losing 10 pounds a month for your first 8 months, obviously. So you have to keep everything in perspective here. But that was the first thing I did. I went to a low-carb diet, and it worked really, really well for me. Why this is important is because, in my wellness company, we do a lot with diabetics, type 2 diabetics, and we get them moving from type 2 into the pre-diabetic stage for most people, and start steering them off of all the meds are on. In my case, I was on I gained 150 pounds. I was on 7,000 units of insulin a month. 7,000 units of insulin a month. Can you imagine this? 150-pound weight gain, and then I woke up one day 400 and some pounds saying I got to get off this. What happens when you start coming down with a low-carb diet? I had to do this hand in hand with my doctor because I didn't need as many meds, and you got to be careful about taking severe blood sugar drops while you're doing this, because you're not going to need as much insulin, especially in my case. I'm off of insulin now. I've eaten this way for the last, 4 years. I found it really easy to carry on this. Now, people say it's unsustainable. Well, I hate to differ with them, but it's been very sustainable for me, and I enjoy eating like this. Matter of fact, it's completely changed the taste buds and how I eat and everything else. So it hasn't been difficult for me to do, but this is what's up with it. So we can get into a lot more on this from the 80 pounds down. Then I went to intermittent fasting. I added that in, and we'll do a whole episode on that on another time. But the low carb or very low carb diet has proved effective for putting type 2 diabetes in remission according to actual peer-reviewed studies. And again, I say this because I get a lot of people coming to me telling me, they want to put their diabetes and their type 2 diabetes in remission, but they don't want to give up their pastas and their rice and this and this and this, things that are really full of carbohydrates and are very high carbohydrates and will definitely spike your blood sugar. And I always tell them, well, eat that, tell me what your blood sugar is after. You don't have to believe me, you can just believe your own body. Your own body will tell you what to do, so whichever way you decide to go with this stuff. But I'm telling you, peer-reviewed studies are telling us this, that this stuff works. So, take what you will from this study, make your own conclusions, and then make your own decisions. We're driven by decisions. I often post my blood sugar numbers, and I always say those numbers are a result of two things. Number one, the process I'm doing, and number two, they're the results of the decisions I've made. So if I post the numbers when I go to bed, those are the results of the decisions I've made today, and you have to make your own decisions. However, to recap this, and it seemed to work better in the first 6 months, and they suspect it's because it was easier for people to stay on it for the first 6 months. A lot of people don't have the willpower to go further, and they test it again in 12 months. But they've tested, thousands of people with it, and these are the results they're getting. So take it for what it is. Take it for what you will. Make your own decisions. Team with your doctor. I am not a doctor. I say this all the time. I tell you what works for me. I show you my results. But team with your doctor. Make sure you're getting a good doctor, and you can go get this done. Hey, listen, my name is Dan. This is Diabetes Army Rebuild. We're going to rebuild you. We're going to create some positive awareness and see if we can get everybody living longer, healthier, and happier. I hope you're having a fantastic day. Please follow me on Instagram, Diabetes Army, TikTok, Diabetes Army, YouTube, obviously, Diabetes Army. So I'm all over the place with this. And if you hit me up on Instagram, it's probably the best place to get a hold of me, and I will answer back. I look at the comments on YouTube, of course, and I answer all of those as well. So, and of course, over on TikTok. Let's not forget TikTok. I do a lot of live streaming there. So there we have it. There's the results. Does keto low carb work? 100% yes. Studies, peer-reviewed, are telling us this. Have a great week. I got a lot of great stuff coming, and I've got a surprise actually coming up too. So thanks again for listening.